So just put your team numbers under team and your name of university, location, whatever else under name. Because when I call on you guys, I will be just calling you based on your team numbers. So that becomes very important to be clear. I'm going to turn off the buzzer right now and then I'll turn it back on in a little bit. Again, in under team, please put in your team numbers and under name, please enter your team name however you want to enter it.
I will go ahead and text Chattanooga, so we will let them know that we are needing them ASAP.
Hi, Dr. Goldberg. Good to see
Hello.
you.
Hi, good to see you.
Good. So you know that your teams are not labeled. So top row, left to right, 1, 2,
1 to
3, 4,
6.
5, 6.
Yep.
And then bottom row, left to right, the same, 7 through 10, 7 through
Excellent.
12. Thank you.
Dr. Goldberg, on the last team, we had some people in Florida tell us how cold they were down there. So I was looking at, these guys might have a little more thick.
Yeah, I think it's about 5 degrees in Chicago right now. So.
Oh my gosh, we got the northern states represented here, guys.
Just turn the buzzers on very quickly if everybody wants to try buzzing in.
Try buzz. Turn it on.
Team 7, 3, and 11, you guys look perfect. Team 9, if you could just delete Stanford from your team name, that would be helpful. If that's painful, that's fine, just leave it in. Same for team 4, Vanderbilt. If you could delete Vanderbilt under team, leave it on your name part, but not under team. You can do that. UCLA and team 10, I think you switched around. If you can put team 10 under team and UCLA on the other side, that would be helpful. I only got buzzes from 7, 3, 11 for team 9. Looks good. If you want to name yourself under name, that's fine too. Oh, Stanford, yep. University of Minnesota, I think you flipped around too for team and name. If you can put your team number under team as team 1 and University of Minnesota. UCLA, you look perfect. ETSU team 8, again, if you can flip around, that would be helpful. Minnesota, you're perfect.
Flip around the names.
Team Vanderbilt, you can name yourself as Vanderbilt under name if you want. Team 8, you're perfect right now.
Sorry, so is it the player name or the team name that you want the number on and then?
The team, I want the team number. And then under name, you can put your program name or your personal names, however you want to put it. That's fine, whatever you feel.
So this is the one that we're supposed to teach.
Okay, thank you.
I'm going to just reset the buzzers to on if everybody wants to buzz in again. Vanderbilt, if you can switch it around under team, if you can put team 4.
Good. Yeah, we're good.
Vanderbilt.
2 hours. I don't think we'll need more than 2 hours. Bring her back up. Just
11 seem perfect. I don't have the other teams though.
Yeah. Let's put it here. Put it on. Just turn it on and just go to that site.
Looks good. Team 10, can you try buzzing in?
I just have to do one. Yeah.
So I have 1, 3, 9, 7, 8, 11, 4, and 10. Team 6, if you could switch it around again, under team, if you can put team 6, and under name, if you can put it as UTHC, UTHSC Memphis. Can you switch it around? So we have 10 teams as of now. No, 9 teams. Mayo, are you on? Team 2.
I see that they're on, I just don't hear them or see them.
Are you able to text or email them, Miriam, or?
Yes, I will give them a text.
Thank you. All right, one more time for the buzzers, please. All right, I got all 9 and everything looks great. Thank you all.
Good job, everybody.
Team 9, if you want to put your name under name as Stanford, you can do that under name, not under team, but under name, but that's up to you. But otherwise,
This is business, but I don't know how we're buzzing. Is this buzzing?
Yeah. If not, we can try using another computer.
And we're going to start around 2 p.m. Central Time. So if anyone needs a bathroom break or anything, this is probably a good time to do that.
So can you, and how is the video turned on?
No, it's not turned on here.
Oh, start the video here.
so while team 2 is getting set up, just to introduce ourselves, I'm Mahi Ashwat, a professor from the University of Iowa, and I'm also the president of the Iowa chapter of the ACC. And along with me is Dr. Goldberg, who is the main moderator for the meeting. He will be running all the questions and everything. Goldberg is from Rush University. Dr. Anderson is our scorer.
Why don't I just open the Zoom link here?
Is
Just no microphone here.
Can you please mute yourself if you're not on?
No, I don't. Oh, okay. Oh, we'll just use my phone then. Yeah, I think let's use your phone. Sorry about
that. Miriam, I see UT Chattanooga messaged and needs a new link sent to them or something. So the way it's going to work is Dr. Goldberg will be reading the questions. He will pick the first question, and after that, the subsequent questions will be picked by the team which has answered the last question right. All questions will be have to be answered like a question. For instance, what is kind of a thing. Let's say the question is the color of milk is. When it comes to is, I'm going to turn the buzzer on. Buzzers will be off until the question is completely read by Dr. Goldberg. When he comes to the last word is when I turn the buzzers on. So if you want to keep buzzing while he's reading the question, that is up to you, but it'll only turn on and come to me after he finishes the question and I turn the buzzers on. So again, usually the teams, it goes very fast. There's only microsecond gap between your responses. So be mindful about that if you're not called on. So depending on the responses, I'll call team 1. They get it right. We end it right there. They get it wrong. I'll call on the second team and the third team. After the third team, we will not call anymore. So even though you might have buzzed, if you're beyond number 3, you will not be called on. And if the first team gets it wrong, they get a deduction. Second team gets it wrong, they also get a deduction. And the same goes for the third team. As a double Jeopardy question, only the team which picks that question can answer. They can wager up to the maximum amount of points that they have, or they can wager if there's less than 400, they can do up to 400 for single Jeopardy and up to 800 for double Jeopardy. But that is only the team that has picked can answer, the others cannot respond. So by chance, if I turn the buzzer on by mistake and you're buzzed in, you will still not have a chance to answer. It's just any question?
Excuse me?
Yes.
Can you hear us?
Yes, team 2, Mayo.
Yes. So we didn't test our buzzer.
Yes, I'm going to do that again. I'm going to reset the buzzers. I just sent the link and the code again for any of the teams which joined in late. I'm going to reset the buzzer and do it again. All right.
Quick question. Is writing allowed during the competition or no writing allowed during the competition?
As long as it's limited to you guys, there's no calling a friend or calling for help, but you can do what you want to do between your teams.
So we can write. Okay.
You still have to answer though. You still have to buzz in and you still have to tell. It's not like you can put the answer in the chat window.
Right.
No, in terms of like making notes.
Yeah, like doing math.
It's gonna send another email.
Not a problem.
Okay, thank you.
We muted right now.
Yeah.
All right, turn the buzzers off again if everybody wants to test.
Yeah, we're gonna test team 2, Mayo.
Please.
Did you get a buzz?
I did not get team 2 yet.
Okay.
I got 9, 1, 11, 8, 6, 7. I got 10. So again, the main rules is buzzing in will start when the question is completely read. Only the first 3 teams will be called on for answering the question. If you have a wrong answer, all the 3 teams could potentially get negative points. Do you have any questions? All right,
So we're still, excuse me, we're still trying to figure out our buzzer. So we didn't get a game code. Or where's the game code?
Check in the chat box. It should be 8KV1.
Mayo, looks like you are logged in twice. Are you logged in from another system somewhere?
No. Please mute it.
Yes, that's good.
Okay. Okay. Is the buzzer working?
Yes, I got it now.
Okay, thank you.
Absolutely. I'm going to turn the buzzers on one more time. If all the teams could please buzz in. I have 10 teams which buzzed in.
Someone is going to take care of the buzzer change, and then we tell you buzz, you buzz, if we know. And then we run the answers by each other.
Thank you, Chattanooga, for joining. I understand that you had some troubles, but we're glad you're here. If you could please rename yourself to Team 5, University of Chattanooga.
We're here.
We're having technical difficulties.
Sure, we understand. We'll work with you.
A
Just want to let you know your
terrible
team.
Wi-Fi connection now rather than our wired computer, but it's okay.
Okay. Hopefully that will work out for all of us. You are, just so you know, if you could please rename yourself when you do have the opportunity, please rename yourself to Team 5, the University of Chattanooga. Sorry, that's my 3-year-old. Sorry.
He's checking.
Let me write down.
I have.
Let me write
Yeah,
down.
let's just.
I'll download this. That's fine.
You have it. Maybe we'll use yours because I can't log in from the work.
Are you able to send the team list again like the last time, or Deanna?
Yes, I can take care of that right now.
Chattanooga, I put in the buzzer website and the code.
Oh, I have a quick question.
Go for it.
Regarding the buzzer, if we hit, just to be clear, if we hit the buzzer before it's actually open, is there any sort of penalty for that?
You know, it'll not come through, right? It'll be grayed out. The buzzer will be grayed out, so it'll not come through. So if you hit early, please keep hitting. Don't stop hitting.
Okay.
Until it's ready, it will not come through to me. So then we don't want you to miss your turn either, right? So
okay. So
it'll
there's no
only be
delay or
opened
anything.
after I read the last word of the clue.
Okay. Thank you.
And they're so fast, you guys. Sometimes it sounds like your brother's not going through, but trust us, they are. It's just like tiny bits of time between them.
truly microseconds. So Chattanooga, are you able to get into the website and?
Yes, we are. We're logging on right now.
Okay.
Okay.
Mayo, I think twice again. Is it a different system?
Sorry, what's the question?
She's logged in again.
I think you're
Oh, oh, we're just making sure that there is a backup login in case battery runs. We're gonna log out pretty soon.
Oh, go ahead, Mahi, but I just wanted to let everyone know that in the course of the game, if at any time you discover your buzzer is not working, let Mahi know. We will do a timeout. Yes, we want to limit the number of interruptions, but at the same time, we don't want to wait till 30 minutes into the game to hear that your buzzer was not working. So if during the course of the game, your buzzer is not working, let Mahi know, the buzzer controller. She will take a timeout for everyone and will give you time to switch your device or test the buzzers. Okay?
Chattanooga, if you can name yourself under team, please enter team 5. Under name, please enter Chattanooga.
And Letitia, you said this is a north and south, right? This is really a north and south competition.
I want to talk, but I'm too chatty for these guys. I think, yeah, it's exciting, right? Well, aren't you in like North Dakota, Nikki?
Well, I'm in Wisconsin, but yeah, we have the teams here today are both north and south,
This
so
is
it's really nice.
cool. I mean, we should start having people email in the degrees Fahrenheit they're living in right now. 38 degrees in Jacksonville. That's not looking good for tomorrow, guys.
Can everyone see the Jeopardy screen?
Yes, we can.
Yes, we can.
Okay.
I'm going to turn the buzzers on. Chattanooga, are you ready or to test it out? Chattanooga, can you hear me?
Yes, we can hear you.
Buzzer?
This is everybody's 5-minute warning, okay? We're going to start at 2 o'clock Central Time.
Chattanooga, are you with us?
Here, I got it here already if you want.
Excuse me, we want to let you know that we're still having trouble setting ourselves.
Oh, no,
I'm going to turn the buzzers on. If everybody wants to try buzzing in again. Chattanooga, if you can swap it around the other way. Under team, if you can make it team 5. And under name, if you can put it UT Chattanooga. Can the other teams buzz in too, Mayo? I don't have your buzz.
We are in the messenger.
Security check.
I have all the teams buzzed in right now. Chattanooga, if you can just rename yourself. That's perfect. That looks great.
I saw like 5 was pressing good, right? I saw like 5. Yeah, that was
Does anybody have any questions or? So again, the rules are the buzzer will turn on when Dr. Goldberg is at the last word on his question. And if you want to keep buzzing in between, you can do that, but the buzzers will not go through until the buzzer is turned on. Just remember that. And it can be pretty close. You're only calling the first 3. I will not be calling on the other team. So if you're not called on, it does not mean that you have your buzz didn't go through. It just means that you're not in the top 3 over there.
And remember, there is a penalty for guessing wrong, so make sure that you know your answers beforehand.
If you ask, so once I pick a team, then Dr. Goldberg will start the timer at the bottom of the screen, and you have 7 seconds to answer your question. If you do not answer in the time, we will have to move to the next team. The next team will have to answer right away because they already had the time in between with the 7 seconds. So.
We're going to start in about 2 minutes. We'll have everyone introduce themselves and where they're from, and then we'll go ahead and get started in 2 minutes.
Best of luck, everybody. Have so much fun, okay? That's what we're here for. You guys are all smart and don't take many breaks, so good luck.
And don't forget to mute yourself if you're not talking. So if you're not given an answer, just turn off your mic and you can discuss among yourselves where you're off the mic.
All right, 1 more minute, we'll get started.
We can hear the whispers.
That is funny. I hear it too.
It is
Somebody's
so cute.
unmuted.
It
Don't
is
tell
so
us your
cute.
secrets.
Sorry, that's me.
Okay, everybody ready? All right. Everyone hear the Jeopardy music? Good. All right, so welcome everybody to the VOG Fit Jeopardy. We're going to go ahead and get started. If everyone could please introduce themselves, we'll start with team 1. Team 1. Team 1, I believe you're muted.
You can go ahead and
Dr. Goldberg, click on the board. Click on the word board, that purple
Okay.
box. There you
I
go.
was waiting for introduction. Okay. Should we just go ahead and get started then?
You can do the instructions now, yes.
Okay. So team 1, can you introduce yourself, please? Turn yourself off mute.
Hi, we're the University of Minnesota.
Thanks for coming. Team 2.
Hi, we are from Mayo Clinic.
Welcome. Team 3.
Hello, everyone. We're from Nebraska, University of Nebraska in Creighton.
Excellent. Team 4.
Hey, everyone. We're representing the Vanderbilt University Medical Center from Nashville.
Welcome. Team 5.
Hey, this is the University of Tennessee at Chattanooga.
Welcome. Team 6.
This is the University of Tennessee in Memphis.
Team 7.
This is the University of Tennessee at Knoxville.
Got a little rivalry here. Okay. Team 8.
Hi, this is East Tennessee State University.
Okay. Team 9.
Stanford University.
Excellent. Team 10.
UCLA.
Okay. And Team 11.
This is University of Mississippi Medical Center from Jackson, Mississippi.
Excellent. Welcome all teams. There's no Team 12, right? So we're going to go ahead and get started. We're going to start with the $100 clue and vascular. After that, whoever gets the correct question will be able to select the next one. Okay? Everybody ready? All right, let's go. So vascular for 100. So mutation in transforming growth factor beta type 2 and type 3, also known as TGF beta 2 and 3, leads to this aortopathy.
Team 11.
Dilated. What is dilated ascending aortic? Dilated ascending aortic or aortic dissection?
That is incorrect. Who is the next team?
Team 2.
What is Marfan syndrome?
That is incorrect, team 2.
Team 4.
What is Loeys-Dietz syndrome?
That is correct, team 4. Sorry, scorer, I missed the first team to buzz in. So team 4 got it right.
Team 11 and team 2 got it wrong.
Okay, so team 11. So that'll be this one. So that is correct. The correct answer is Loeys-Dietz. And it is true that they can undergo sudden dissection. However, we were looking for the name of the disorder. So team 11, let me go back to the board.
Not the aortopathy, but actually the diagnosis.
One moment, please. Having a little trouble with the scoring here.
I'll be doing it manually just in case.
Okay, it's not, I'm hitting adjust scores and it's not allowing me to mark team 11. You see that?
Yes.
Okay. All right. So the team who just got it correct, what is the next one you'd like to do?
We'll take vascular for 200, please.
Okay, vascular for 200. One moment. Doesn't appear to want to work. And I'm not on a Mac.
That's okay. Letitia, is it working for you? We can give you the screen to take over and then you can run it.
Mine just froze up too. I just shut down the computer. I'm restarting it. So hold tight. It worked yesterday.
Okay.
How about maybe Liana?
I can restart it as well. Yeah, for some reason it's getting stuck. I am not on a Mac, I promise.
We got this, you guys. Sit tight.
That's okay. So why don't we give the screen back to Mahi and then Dr. Goldberg, you just restart the entire thing. We only got one question done anyways.
That's correct. All right, I'm stopping my share.
Thank you all for joining us today. I'm sure you have things to do, and I'm sure you'll have a lot of fun with the competition. While Dr. Goldberg is resetting the screen, just to introduce ourselves, Dr. Goldberg is an imaging cardiologist from Rush University in Chicago. Dr. Anderson is joining us from Nevada. We have Dr. Ijeoma, who is the chair of the Jeopardy committee. And my name is Mahi Ashwath. I am an associate professor at the University of Iowa and the president of the Iowa chapter of the ACC. I'm guessing you guys don't have any questions about the rules at this time yet.
Okay, can everyone see the screen again?
Yes.
Okay, I'm just gonna go through the $100 question again because we already did it. So we already did this and we said that team 1 got it incorrect. Or was it, what teams got it incorrect, please?
11 got it incorrect.
Okay, so 11 was incorrect.
There
yes.
we go.
4 got it right.
4 got it correct.
Was it team 2, I think, which got it wrong too?
Yeah. Team 2, incorrect.
Okay. I think this is the problem we ran into last time. All right, let's try.
Team 2 also got it incorrect.
Working on it. I think this is where the bug is. Okay, let's try.
Nice picture. So Dr. Goldberg, if you hit the 100 question again for that particular question.
Yes.
If you go back to it and then now deduct the score from the team that got it wrong.
Okay, so this was which team? Sorry.
Team 2.
2. Okay. There we go. All right.
Did it
So
work?
now we can go to the next. Can you guys all see my screen?
No.
Okay. Let me
Yeah.
screen it again. All right. You guys see it now?
No.
No.
Not yet.
Okay. How about now?
There we go.
Good.
Perfect.
All right. So I think the
Nice.
score should be correct. We can go on through this. We can go back to the board. Okay. Sorry about that. Let's go to 200, right? Everybody ready? Let's try again. All right. So mutation in collagen type 3 alpha, COL3A, leads to this aortopathy.
11.
What is
11. He said 11.
what is Ehlers-Danlos syndrome?
So the answer is, what is Ehlers-Danlos syndrome? And that is correct. So that was team, which team?
Team 11.
Okay, so team 11, you get 200. And very good. All right, let's go back to the board. All right, team 11, it's your choice.
Vascular for 300.
All right, vascular for 300. This medication, which is typically prescribed to assuage claudication symptoms, is contraindicated in CHF of any severity due to inhibition of phosphodiesterase.
9.
What is cilostazol?
That is correct. Who answered that? 5?
9.
9. Okay, so that would be this one. Excellent. So that is correct. What is cilostazol? So team 9, it is your turn to pick.
4 did not get added, Alan.
Team 9, it did not? Should have. Let's go back.
It did because it advanced the slide. So it only advanced the slide if you got it correct in the scoring system. Letitia, can you verify?
He's right. It just isn't working. It's almost like a glitch. So yes, he's right. It didn't add on there, but team 9.
Okay, well, we'll do
300.
manual then. That's fine.
Oh, I got it manually. Yep. Team 9 is
Okay.
300.
We'll do vascular 400.
Okay, everybody ready? Please.
It's tricky. It's freezing the whole board, isn't it, Dr. Goldberg?
Yeah, are you having the same
Yes.
problem?
Yes, I've shut my computer down twice now. I'm wondering if you could we can not share. I wonder, I can see the PowerPoint before I play the slideshow. But you don't want to share that, I guess.
Correct. Yeah, so
Right.
I have it up here. It just appears to keep freezing for whatever
Mhm.
reason.
Yeah, maybe we could just read it out loud from the slide, the PowerPoint without showing the team. Can you see your PowerPoint without the?
As soon as you see green, just
Without the answer showing, we can try. Let me try sharing one more time, okay?
Deal. Hang in there, you guys.
Sorry about this, guys.
Maybe it's the cold weather in Chicago. I'm telling you, we should be down in like Miami or something. Although it's pretty cold there too.
So again, part of the rules is even though we have multiple teams here, you will be basically competing only with the teams from your own state in terms of who will go to the national competition. So when you decide to put in your wagers for final Jeopardy, be mindful that again, you're only competing with the teams from your own state. So, that might help you decide how much you want to put the wager in.
Yeah, I don't know why we're getting so delayed.
No,
At least the ping, they're closer, so they're.
Okay, hold on, that's it. So Bhavin, you go ahead now, you put your hands, your computer, you know better. Don't click anything.
And did you want to check your buzzers? We can just check the buzzers and turn it on. Team 10, if you want to check it. You came through, yeah. Again, it's literally microseconds. So the ones which buzzed in now, it's 11, 8, 1, 10, 5, 2, 3, 7. So it's coming through, but it's just, and then 6, 4.
Okay, let's try this again, all right? I believe we've done 1 through 3 on vascular. Were we going for 4?
Yeah,
Correct.
Okay, so let's go to 4. Oh, it's a daily double. Oh joy. All right, so the team, what is the bet? What is the wager you want to wager?
Let's do 300. We'll do 300.
300? Okay.
Maximum up to 400 to wager.
All right. So this is only for the team that just rang in. So chronic venous insufficiency and venous hypertension are clinical conditions which can be confused for lymphedema. In comparison to lymphedema, these body parts are spared with CVI and can be used to aid in the clinical differentiation between lymphedema and CVI.
What are the spaces between the toes?
So we will accept that. So feet, digits, toes, absolutely.
Good
Excellent.
job.
Okay.
So Stanford has plus 300. They're up to 600 now.
Okay, so we have 4 categories remaining. Which would you like to do next?
We'll do muscle for 100.
All right, muscle for 100. One moment, please. So the gold standard for diagnosing myocarditis is?
Male.
What is endomyocardial biopsy?
That is correct. An EMB is considered the gold standard. Cardiac MRI can be helpful, but EMB is obviously the gold standard that we use. Okay. Do we have the points for that one taken down?
Yeah, they're up to 0.
Okay, excellent.
Which one want to buy? Yeah, both of them.
What would you like to select next?
Muscle for 200.
All right, muscle for 200, coming right up. In the first 8 weeks of initiation of this heart failure medication, NT-proBNP is the preferred measured cardiac biomarker and not BNP.
Team 10, UCLA.
What is sacubitril valsartan?
That's correct. Very good. So BNP may increase meaningfully early in the initiation after this medication. So NT-proBNP is the preferred marker to use. Very good.
Good.
All right. What would be the next choice?
UCLA.
Can we do muscle for 300?
You may.
Ooh.
An 85-year-old man with shortness of breath has normal LVEF, and the tissue Doppler shown below. The most likely diagnosis is?
Team 2, male.
Is heart failure with preserved ejection fraction?
I'm sorry, that is not specific enough. Who's next?
Team 11, Mississippi.
What is diastolic dysfunction?
I'm sorry, again, that is not specific enough.
What team was that? What team was that?
It was team 11.
11, not specific. Okay, got it.
Team 8.
What is restrictive cardiomyopathy?
You guys are all very, very close and along the right lines, but we are going for what is cardiac amyloidosis. This is the so-called 555 sign, where you see all these tissue Dopplers are below the -5 and 5 levels. And this was consistent with cardiac amyloid, which I agree everyone does have restrictive physiology and diastolic dysfunction, but this is the more correct answer. All right, so no points awarded on that one. So the previous team.
Sorry to interrupt. How many teams would you guys call?
3.
Okay.
Okay. All right. So I'm sorry, who picked the $300 clue?
I think that was us. May we have muscle for 400, please?
You may have muscle for 400. All right. So we're looking for the syndrome here. Neutropenia, muscle weakness, and the echo findings below are consistent with this syndrome.
Team 10, UCLA.
Is this Bart's syndrome?
It is Barth's syndrome. Excellent. Well done. So it's a genetic condition, mainly affects males. You see a low blood cell count, weakness of the muscles, and fatigue. And the echo findings that we were showing there was non-compaction cardiomyopathy. Excellent job. All right, we have 3 categories left. What would you like to select?
Could we grab Born Forever for 100, please?
Yeah, one moment, please.
Team 8, please mute yourself.
Born Forever for 100. The cyanotic heart disease for which an atrial baffle procedure was done as a palliative procedure.
Team 4, Vanderbilt.
What is transposition of the great artery?
Can you be more specific?
Detransposition of the great artery?
D as in dog?
Yes.
That is correct. Well done.
And again, so everybody knows I have 9 teams which buzzed in for this question. So your buzzers are coming through. It's just the timing.
And here's an example of the baffle shown on the right. All right. So what is the next question?
We'll take pipe for 100.
Pipe for 100. The inability to lift the skin over the second toe.
Team 2, Mayo.
So what is the sign they're showing?
Stemmer sign.
Can you say that again?
What is stemmer sign?
Excellent. Very good. So this is an example of stemmer sign, which is often seen in lymphedema. Excellent job. Okay. What is the next selection?
Born Forever for 200, please.
Born Forever for 200. Protein losing enteropathy, a complication of Fontaine's procedure, is diagnosed by detection of this in the stool.
Team 2, Mayo.
Alpha 1. What is alpha 1 antitrypsin?
Excellent job. Alpha-1 antitrypsin is the correct answer. Okay. What is the next selection?
Mayo. Mayo, you have.
Yes. Born Forever for 300.
Okay. This coronary anomaly in tetralogy of Fallot, also known as blue babies, needs to be ruled out before surgery.
Team 4, Vanderbilt.
Anomalous origin of the right coronary artery.
Anomalous origin of the right coronary is your answer?
Mm-hmm.
That is incorrect.
Team 7.
Anomalous left from the right, crossing in front of the RVOT.
That is correct. Excellent job. So in tetralogy of Fallot, the LAD can arise from the right sinus of Valsalva in about 10% of patients. So it's something that needs to be ruled out prior to proceeding with surgery. Excellent job. Okay. What is your selection on the board?
Team 7.
Born Forever for 400.
All right, Born Forever for 400. Familial ASD with, that's atrial septal defect, with congenital abnormalities of upper extremities describe this syndrome.
Team 4, Vanderbilt.
What is Holt-Oram syndrome?
That is correct. Good job, Vanderbilt. So also called heart-hand syndrome, but it's often seen with an ASD and then upper limb disorders. Very good. Okay. Which category would you like next?
Let's do pipe for 200, please.
Pipe for 200. This syndrome area will cause persistent swelling with or without deep venous thrombosis.
Team 11, Mississippi.
What is May-Turner syndrome?
That is correct. So you get iliac vein compression syndrome, and the left will be more edematous than the right. Excellent job. All right. Next category.
Pipe for 300.
Pipe for 300. Painful hands of a young smoking man. This is the diagnosis.
Team 2, Mayo.
What is Buerger's disease or thromboangiitis obliterans?
Excellent. You got both of them. Very nice. So it's a non-atherosclerotic disease of the small, medium-sized arteries and veins of the upper and lower extremities. The key word is tobacco use in this case. Very good. All right.
Mayo.
Pipe for 400.
Pipe for 400. The cutoff for aortic repair in a pregnant woman with Marfan syndrome. We're looking for a value.
Team 2, Mayo.
What is 40 millimeters?
Excellent. Good job. All right. We got one category left, one way.
Just 100.
Yeah. One way for 100.
One way for 100. Heidi syndrome describes chronic gastrointestinal bleeding due to gastrointestinal angiodysplasia and this valvular disease.
Team 2, Mayo.
What is aortic stenosis? Severe aortic stenosis.
Very good. Severe aortic stenosis is correct. So you get slicing of the von Willebrand's factor, which can cause angiodysplasia and bleeding. All right. Next one.
One way for 200.
Very good. This phenomena explains the discrepancy in gradients when evaluating an aortic mechanical bileaflet prosthesis by echocardiography and by invasive assessment.
Mayo, Team 2.
What is pressure recovery phenomenon?
That is correct. Well done. It's pressure recovery. All right, next category, please.
300.
One way for 300.
Okay. Get your paper ready. So the alias velocity is 40 centimeters per second. The MR velocity is 500 centimeters per second. The Pisa radius is 1. This is the EROA.
Mississippi, Team 11.
What is 0.5 centimeters?
One moment, please. That is correct. Well done. So here we have the EROA formula here, and it nicely went to 0.5. Okay, last one. One way for 400. Everybody ready? So the mitral regurgitation, as shown on the image obtained post-TAVR, suggests this condition, and please be specific.
Team 9.
What is high-grade AV block?
Not quite. Next answer, please.
Team 6.
Entrapment of anteromitral leaflet.
That is incorrect.
Team 11, Mississippi.
Severe AI or perivalvular leak. Severe AI causing diastolic.
Very good. That is the correct answer. So you can see on the arrow here, you're seeing diastolic MR, which is concerning for aortic regurgitation or perivalvular leak following a TAVR. Very good. All right. So that is the end of round 1. Can we go over the scores, please?
Okay, you guys ready? I'm doing the math right here with my pencil. So team 1 is Minnesota, no points. Team 2 is Mayo with 1,000 points. Team 3 is NB, which must be Nebraska, 0 points. Team 4, we got Vanderbilt with 300 points. Bear with me, I'm doing this live. UT Chattanooga is team 5. You got -100, so you're close. Team 6 is UT Memphis, UTHSC, -400, so hold tight. Team 7, UTGSM, 300 points. Team 8, ETSU, -300 points. Keep trying. Team 9 is Stanford, and you guys just got that last one wrong, so you are positive 200. So good job. And team 10, UCLA, you guys got 600. And last of all, but not least, we got UMass here with 700 points. Whew,
Very good job, teams.
Great job, everyone. Thank you, Letitia.
Sorry about the technical difficulties. We're going to take about a 5-minute break. So 2:35, we'll come back. We'll try to get the scores adjusted on the board, and then we'll start Double Jeopardy round.
I'm going to be doing a quick audience question. So if you want to get ready for the audience. All right, you can all see my screen, okay? Please submit the answers in the chat box, and the first correct answer will get the $30 Amazon gift card. This famous medication can cause false positive PYP scans suggesting cardiac amyloidosis. What's the name of this medication?
So where should we submit it?
This is only for the audience.
Oh,
not put it in the chat. The audience can put it in the chat. All right. The first correct response is what is hydroxychloroquine, and it is given by Dr. Hee-Jing Nguyen. I hope I'm saying the name right. Congratulations. You will get the you'll get the Amazon gift card. If you could just put in your email address to the panelists, we will get that taken care of. Congratulations. I have a question. If all the teams are able to buzz in, okay or not. So if you want to try the buzzer again, I can do that. I can just reset the buzzer. And we can just test the teams and the buzzers again before we start. I'm going to turn on the buzzer in just a second. Please buzz in.
Dr. Anderson, if you could send me in the chat the scores, then I think I can update them for the next round.
About to do that, and I'm double checking because I got a nice little note from team 5.
Okay, thank you.
Yeah, I apologize, guys. Let's just call you 0. My math must have been off on that. I apologize. And Dr. Goldberg, I'm gonna right now.
Thanks.
Team 8 and 9, if you want to just test your buzzers. Team 8, if you want to test your buzzer. All right, perfect. I got all the buzzers in.
Just do a couple more minutes while we're getting the scores updated, and we'll start in about 3 minutes.
Great job with the first round, everyone. Very nicely done.
Yeah, it's so nice to see how the teams are handling the technical glitch there. So it's just amazing. This is just good team play, sportsmanship at work. Well done, everyone.
Awesome job, you guys.
I think some of the teams want to reset the buzzers, and that is fine. So before we restart, we can test the buzzers again. All right, go ahead and try your buzzers again. I have 8 teams buzzed in. 11, 2, 9, 8, 10, 1, 7, 4, 3, 5. Missing team 6. If you want to test your buzzer, Memphis. Yeah, there we go. Perfect. It looks like they're working.
Okay, Dr. Goldberg, I showed those all to you with a bunch of text. Let me know if I can also hold my fancy paper up to the screen, which is
I got
pretty.
them, thanks.
This is a pencil, you guys, if you haven't seen one.
Okay, we're gonna get started in about 1 more minute. All right, so 1 minute, we'll start with the new categories. Everyone can see them?
Mm-hmm.
Good.
Quarterback sack for 200.
No, we're not quite yet, okay?
Hey, Letitia, there's a message for you in the in-basket. Don't mind taking a look at it from team 9? Thank you.
I'm on it. Yep, sorry about that. Got it. It's team 9. Got it.
Hey, Dr. Goldberg, Letitia's going to look into a little bit of an issue before we get started on the next set. So
not a problem.
Thank you.
Good point. Good job, team 9. I think Dr. Goldberg, I think they're right. Team 9, should we give, I'm going to ask the other helpers. Team 9 is Stanford, and they had AV block as a secondary answer. Could we give that 400 to them as well, or how does it work in primary Jeopardy?
Sorry, can you repeat the question?
Yes, the question was that Team 9 submitted an answer to the 400-point question, and it looks like it was a secondary answer. I'm looking at the PowerPoint slide for that. They're right. So they did have that as a secondary answer. How do we adjudicate that?
I think we give them the score as well.
Okay, cool. Good job, Team 9. So we'll correct that up. So Team 9 is going to be 600 total, Dr. Goldberg.
Got it.
I think it should be 1,000. I'm sorry. I think it might be 1,000 because we got 400 deducted from 600 to get to 200.
Thank you. Yeah. Thank you. You're exactly right. I used up my eraser, so I missed that part. So 1,000 for Team 9 Stanford. Thanks for being sportsmen about that, guys.
Team 9 Stanford should be 1,000.
Yes.
Okay.
To all the teams, if you have questions about the buzzers or the scores, please communicate as we are going on. Don't wait till the very end. So.
One second, just trying to adjust the score.
It looks like this board's looking pretty good, Dr. Goldberg, the double Jeopardy board.
Yes, I think we're almost there.
Minnesota and Mayo, how much snow did you guys get? Is it still snowing or? How much snow did you guys get?
We have about 5 inches in southern Minnesota.
That's
Wow.
not bad, I guess.
You always wonder in Minnesota if the degrees Fahrenheit is higher than the inches of snow you just got overnight, right?
That's true.
You guys are tough.
Stanford, how is the COVID situation in California?
Getting better now, at least in Northern California. We're actually, our hospital numbers are going down, so very fortunate.
That's
Wow.
good. High time, yeah.
You guys got all your vaccines? Cool. We read about you in the paper. Good job.
That was not good.
But not good then. Good now. Wow.
Okay, we should be ready any moment. 1 second. Okay, can everyone see the screen?
Wow, it looks great. Perfect. Good
Everything
job.
looks correct now?
A+.
All right, so I think in the double Jeopardy round, it's usually the team with the lowest score who gets to pick first. Is that correct? So that'd be team 6 with -400 gets the first crack.
Okay, cool. We do Pet Project 200.
Okay, everybody ready? Let's go. Move over, Kris Jenner and Kim Kardashian. This is the parent of rubidium 82.
Team 11, Mississippi.
What is technetium?
That is incorrect.
Strontium what?
Did we get an answer there?
Team 8.
Strontium 82.
That is correct.
Yes. Yeah.
So it's produced through beta plus decay from its parent nucleus, strontium 82.
And that was team 8?
Oops.
Oh, that
Team
was
8.
8, yes.
Team 8, and then you got to do -200 for team 11.
Okay, one moment. This is where we had trouble before.
Oh, geez.
That's okay. We can adjust the scores.
Yep.
Okay, sorry. Tell me who to take points away from.
Team 11 -200.
Okay,
And
so we'll be
team
at 500.
Team 8 just got it right.
That'll be a -100.
200.
All right. All right, next question, please.
We'll go with Pet Project 400.
Pet Project for 400. All right, this scan is concerning for ischemia in this coronary territory.
Team 11, Mississippi.
What is the LAD?
That is correct. So team 11, you get the points. That's the left anterior descending. You can see that there's ischemia in this territory, which corresponds to the left anterior descending. Very good.
And Dr. Goldberg, it's Letitia. Just I think they didn't take off that 200 from them.
Okay.
That makes sense?
Yes, sorry.
Sorry about that.
That's okay. What was the team?
Team
Team 11.
And they should get how many points off?
Excuse me?
We got 200 right, so we're at -100 right now.
Which team was that? I'm sorry.
Team 8, ETSU.
So it should be that.
Yep.
Okay.
Team 8 and then team 11.
Team 11 should be at 900.
Right.
Sorry about this, guys. Thank you for bearing with us and being patient. Okay. All right, next, oops, sorry. Oh. Okay, next category.
Pet project for 600.
Okay, pet project for 600. Okay, a 72-year-old female with prior ST elevation myocardial infarction, atrial fibrillation, and chronic kidney disease presents the emergency department with dyspnea. Transthoracic echocardiogram demonstrates LVEF of 20 to 25%, left ventricular dilation, and akinesis in the LAD distribution. A PET FDG myocardial viability scan was performed prior to possible revascularization. The expected outcome from bypass surgery is, and you'll see the rest images on top and the FDG images on the bottom.
Evan, Mississippi.
Yeah, the outcome would be negligible. It's scar.
That is correct. What team was that?
Team 11.
Team 11. So we'll give you the check mark. Very good. So there's no clinical benefit. We have severe defects at rest in the LAD, and there's minimal uptake and metabolism consistent with SCAR, as you mentioned. Usually people only see benefit if there's at least 20% viability, which we do not see in this case. Very good job. All right, next question.
The scores for team 8 and 11 still need to be adjusted.
Okay, why don't we come back to that before Final Jeopardy, because I think we're having a little issue with that.
Agreed, I got it.
Okay, so next question, please.
Pet project for 800.
Okay, pet project for 800. A 55-year-old female with hypertension and dyslipidemia presented to the emergency room with complete heart block. A fasting cardiac FTG PET test was performed, which showed focal FTG uptake in the entire lateral wall. This is the most likely underlying diagnosis.
Team 2, male.
What is cardiac sarcoidosis?
That is correct. Well done, Mayo. So conduction abnormalities are the most common manifestation of sarcoidosis and often causes heart block. You can also see ventricular arrhythmias and sudden cardiac death. All right, moving on.
Excuse me, we have an issue here. We are buzzing like almost in 80% of the questions. We have never been picked up.
Do you just want to test your buzzer? Is this Nebraska?
Yes,
There is same issue.
We're having
We
the
are
same
having
issue.
the same issue. We have been buzzing constantly, but it's not going through.
You guys want to just try buzzing in?
I think it comes through, but maybe it takes longer time to.
There's a delay.
That's what I'm saying. There's some delay.
He's got Mayo internet.
Question: do Mayo and other teams that they get picked, they do have a wire connection rather than wireless, or it doesn't matter?
In general, we would recommend that you use a desktop instead of a phone. Sometimes it helps, but maybe not. It should work either way.
We're using a laptop, so it's wireless. Okay.
What are the other teams that, Mayo, what are you using?
We're also on a wireless laptop.
And it's working for you?
Evidently.
Okay.
And the next time I can read out all the teams whose buzzers are coming through and the orders, so maybe you'll know exactly, give you some idea. And again, there's literally a microsecond gap between the buzzers, so it's not like there's a significant gap between them, if that helps. So
we should improve our buzzing skills.
It's so hard, you guys. You're doing great. Keep it up.
Okay, should we move on to the next question?
You bet.
All right, who's up?
Let's do Take My Breath Away for 200.
All right, Take My Breath Away for 200. As a cardiologist, this is the most common group of pulmonary hypertension observed.
Team 11, Mississippi.
What is group 2?
That is correct.
So, just to give you some idea, within really microseconds, 11, 4, 2, 1, 10, 8, 7, 3, 6, 9, 5. So literally every team buzzed in on this question and it was very close, but it's just the way. So timing.
So group 2 PH is caused by left heart disease, as we all know. Therefore, it's the most common to be treated by cardiologists. Next question, please.
Take my breath away for 400.
Patients deemed responders at the time of acute vasodilator testing may benefit from this class of medication.
Team 10, UCLA.
What is calcium channel blockers?
That is correct. Team 10.
Again, all 11 teams buzzed in.
All right. What would you like to select?
Take my breath away for 600.
All right. So you'll need to give me the letter of the correct response here. So right heart catheterization is the gold standard for diagnosing pulmonary arterial hypertension. These are the cutoffs for diagnosis.
Team 11, Mississippi.
What is B?
That is correct. That was team 11?
11.
All right. So B, so we have a mean PAP of greater than or equal to 25, a wedge less than or equal to 15, and PVR greater than 3 Wood units.
Take my breath away for 800.
Okay. These are the 3 main categories of treatments that are FDA approved for the treatment of PAH.
Team 11, Mississippi.
Endothelin receptor antagonist. Prostanoids. Prostacyclins. And then also sildenafil and the PDE5 inhibitors.
That is correct. Excellent job. What team was that?
11. Good job,
11.
guys.
Way to go. So you had prostacyclins, endothelin receptor antagonists, and then agents that target NO such as PDE5I. Very good. Okay, finished up that category. Let's move on.
Quarterback sack for 200.
Quarterback sack for 200. This is the most useful parameter to exclude hemodynamically significant pericardial disease.
Team 1, Minnesota.
What is blood pressure?
That is incorrect.
Team 6, Memphis.
What is the IVC size?
That is correct. So team 1, was that the incorrect answer?
Team 1's incorrect.
Okay, and then who is correct?
6.
6 is correct. Excellent job, team 6. So a dilated, non-compressible IVC is a hallmark of elevated CVP, but when it's gone, then pericardial disease is most unlikely. Okay, next question, please.
What's your clearance 400?
What's your clearance 400? A 64-year-old man with hypertension and hyperlipidemia presents for a preoperative evaluation prior to an elective left total shoulder replacement. He can complete greater than 4 METs. On auscultation, the following is heard over the left upper sternal border. He has no prior cardiac testing. Based on the 2014 ACC AHA guidelines, this is your recommendation to the referring surgeon.
Mississippi, team 11.
No further evaluation, can proceed to surgery without further cardiac workup.
That is incorrect.
Team 4, Vanderbilt.
What is transthoracic echocardiography?
That is correct. So it is recommended that patients with clinically suspected moderate or greater degrees of valvular stenosis, as was auscultated during this patient's exam should get a preoperative echo, especially if they have had no prior echo within a year or they've had a significant change. So in this case, the patient had no prior imaging, but had a murmur that was suspicious. Very good. Next question, please.
So we'll take unstable genius for 200, please.
Okay, unstable genius for 200. The term typical angina is defined as meeting these 3 characteristics.
Team 4, Vanderbilt.
Substernal chest pain worsened with exertion and relieved by a rest or nitroglycerin.
That is correct. Excellent job. We would have also accepted provoked by emotional stress, but those are the characteristics of typical angina. Very good.
Unstable genius for 400, please.
Which of the following describes the pathophysiology, ECG findings, and biomarker findings in stable angina?
11, Mississippi.
What is B?
That is correct. Very good. So what team was that? Sorry.
Team 11.
Team 11. Very good, Team 11. So B, so you have a stable plaque with demand ischemia, but no infarct. You have normal EKGs and normal troponins. Contrast this with ACS, which would be unstable angina, or NSTEMI or STEMI, which would have changes. Very good.
Well, just to clarify again, I had all 11 teams buzz in and very quickly here, so your buzzers are coming in.
What's the next question?
Unstable genius for 600.
600. In patients presenting with ACS, this class of analgesic medications can increase the risk of MACE.
Team 1, Minnesota.
What are opioids?
That is incorrect, Team 1.
Team 11.
What are NSAIDs?
That is correct. Good job, Team 11. So NSAID should not be initiated and should also be discontinued during hospitalization for ACS as associated with an increased risk of MACE. Good job. All right.
Unstable genius for 800.
Okay. Which of the following describes the pathophysiology, ECG findings, biomarker findings in unstable angina?
Team 11, Mississippi.
What is A?
That is correct. That was which team? I'm sorry?
11.
Good job, 11. So you have a plaque rupture with partial occlusion. You do have some supply ischemia, but no infarct. Your ECG may be normal in this case, and troponin should be normal. Good job. All right, 5 more clues left before Final Jeopardy.
Quarterback sack for 400.
Very good. These 3 clinical parameters make up Beck's triad.
Team 2, Mayo.
What is hypotension, muffled heart sounds, and elevated GBP?
Very good. Next veins are distended. Muffled heart sounds and hypotension are the constellation of symptoms that can be seen in pericardial tamponade, known as Beck's triad. Very good. All right.
Quarterback sack 600, please.
In constrictive pericarditis, this pattern of diastolic flow reversal is expected in the hepatic veins in expiration and inspiration, so I need both.
Team 10, UCLA.
Hepatic vein diastolic expiratory flow reversal.
Normal.
So I need inspiration and expiration, please.
And normal flow and inspiration.
Yeah.
Can you repeat it one more time, please?
Expiratory flow reversal and normal during inspiration.
Okay. So you're saying increased flow reversal with expiration, and you're saying normal with inspiration? Was that your answer?
Sorry. Increased and decreased.
Is that what you said the first time?
That's not what we said the first time. We just changed
Okay. What team was that? So that is incorrect. Your first answer is incorrect.
That was team 10.
Okay.
Yeah.
Team 10. Anyone else care to chime in?
Team 1, Minnesota.
Inspiratory, systolic flow reversal, and expiratory normal.
Incorrect.
Team 11, Mississippi.
Last one.
So you have increased diastolic flow reversal with expiration and blunted with inspiration.
That is correct. Good job. You guys were right all around it, but it was the last answer was correct. So you'll have increased reversal with expiration and decrease with inspiration. All right. We have three more clues.
Isn't that what we said?
No, you said normal. You said I believe
but then we
increased
corrected
and normal,
the last
then
answer.
changed
Sorry, I apologize. The last answer we said was increased and decreased.
Right, but that wasn't what you said initially. You changed your answer.
But aren't you able to change your answer until the time is up, just like a normal Jeopardy?
Well, the time was up. I had asked you for a clarification, and then you changed your answer. So
Okay.
we can go to the rules on this. I believe it was an incorrect answer though.
So you had the right answer and then you changed it. Is that what you're trying to tell Team 10?
No, I believe I asked them to clarify, and their clarification was incorrect, and then they changed their answer after that. So I marked them incorrect.
Do you think that's reasonable, Team 10?
That's fine. I don't know. I feel like our last answer was correct, but that's okay.
Okay. Why don't we move on?
Quarterback sack for 800.
Okay. That is the daily double.
Mississippi, you have 5,300. You can wager up to 5,300. And you're the only team answering this.
We're going to wager 500.
Okay. The most common primary neoplasm associated with a pericardial effusion is, and you have the only answer here.
What is lung cancer?
That is incorrect. Primary neoplasm. So what we were looking for was angiosarcoma. So the majority of cardiac angiosarcomas occur in the right atrium, and they invade adjacent structures, including the pericardium, and they cause pericardial effusion. Okay, so we'll have to adjust your score down by 500 before Final Jeopardy. Okay, we have two left. $600 or $800 clue.
Team 11.
What's your clearance for 600?
Well, that can't. Oh, you all got the other double Jeopardy. So you lost 500. Is that correct?
Right.
So what is their updated score at the moment?
4,800 for Team 11.
4,800. So you can risk any or all of your 4,800.
We're going to just do 100.
100. A preoperative resting 12-lead EKG is reasonable in all patients except this group.
Patients undergoing low-risk surgery.
And what about the patients?
Low-risk patients.
So I'm going to accept that. The correct, what we're looking for is asymptomatic low-risk surgery. So if it's a low-risk patient, I would imagine they're asymptomatic. So there's no benefit in ordering a 12-lead EKG in this scenario.
So Team 11's up to 4,900
Okay.
with that.
Last question. What is your clearance for 800? 2 risk prediction tools which are useful in predicting the risk of perioperative MACE in patients undergoing non-cardiac surgery are
Mayo, team 2.
What is revised cardiac index?
RCRI. What is RCRI and the Gupta index?
That is correct. So Gupta is also known as the NSQIP and also the RCRI. So those are both the preferred risk calculators. Okay, so why don't we take a 5-minute break? We'll get the scores all updated, and then we will show you the final Jeopardy category. You will submit your wagers privately to the scorer so that no one knows what you are wagering, and then we will show you the final Jeopardy answer, and then you will all individually put in your questions. Correct?
I think the wagers go to you, Dr. Goldberg.
Okay, very good. So send it in the chat privately to me. We're going to update your scores, and we'll have those for you in a second before you put in your wagers. Okay?
Only the teams with the positive scores are able to compete in the final Jeopardy.
That is correct. Okay, so give us a couple minutes. We'll regroup at 3:08, and then we'll do Final Jeopardy.
Dr. Goldberg, I only see 2 tiny mistakes. I'll text them to you right now.
Excellent, thank you.
No sweat.
Again, as you think of your wagers, remember the teams with who are the only team from the state will go directly to National Jeopardy, but the states which have more than one team, you're kind of competing against the teams from your state. So as you put your scores, just see what their scores are too.
Great job, you guys.
I got the wager.
Oh, excuse me. Go ahead.
Sorry, I got the
Don't
wager.
send your wagers until we have the clue for you guys.
Yeah,
Or have the category, rather.
I got the wager from Team 10 which sent to me. I'm going to just forward that to you, Alan.
Okay, I will take those down.
But again, you guys can change your wagers until you see the what the category is.
Hey, you guys, why do you think that category was called PIPE? P-I-P-E. Who knows?
Okay, so if we have all the teams, the Final Jeopardy category is going to be pharmacology. I'm going to share my screen right now. One moment.
Good luck, guys.
And these are the updated scores we have here. So team 2 is at 3,000. Team 2 will be able to play. We have team 4 with 900. They'll be able to play. We have team 7 with 300. They'll be able to play. We have team 9 with 1,000. They'll be able to play. Team 10 with 400. They'll be able to play. And team 11 with 4,900. They'll be able to play. So if you could send me in the chat function your wagers for Final Jeopardy, then we will be able to proceed once I have them from, again, team 2, 4, 7, 9, 10, and 11, please.
I think if you click final, Alan, you'll be able to enter their wagers in.
Very good.
But as you enter, I think one thing is you want to put in 4 digits. So for instance, if the $1, yeah, 3 zeros and then 1 kind of thing, yeah.
And if you guys who are sending me the numbers, please send not your team name, but your team number would be helpful. Okay, I think I have them here. Okay, so we have team. All right.
I'm just sending you the wages from team 10 and team 7.
Okay, one moment. I'm just getting these down. Seven I have. And then can team 4 please send me again? Never mind, I have it right here. Okay, so let me enter these. This is interesting. Is everyone seeing multiple boxes over here?
You bet. I think that's, yeah, it looks kind of a little bit crazy. Can you
A little
type the number?
crazy. So we'll probably, we might be able to just do these manually then.
I'm ready.
Okay. I can send you the wagers.
Perfect.
Okay, is everybody ready for Final Jeopardy? I'm going to reveal the prompt, okay? Ready, set, go. So following a routine transesophageal echocardiogram for stroke evaluation, the patient develops cyanosis not responsive to oxygen, headache, and tachycardia. An ABG performed at the bedside was notable for chocolate-colored blood and a normal PaO2. This is the most likely, and I need 3 answers here, the diagnosis, the causative agent, and the best treatment. And you will have 30 seconds. I believe I pressed this button, yes? The answers from team 4 and team 10. So teams 2, 7, 9, and 11. Just waiting on 2 and 11 now.
Excuse me, are we supposed to type in the answer in the chat box or?
Yes, and then send it to me privately, please. So I'm waiting on team 2, Mayo.
As we wait for the answers, there's a comment in the chat box about if the buzzer is precise to the microsecond, but a few teams were consistently able to buzz in first and a few others were never first, it is very likely that there were factors like hardware, software, internet outside of the contestants' control that impacted their ability to even participate in the competition. And it's unfortunate that Final Jeopardy has no impact for greater than 80% of the teams. And that is probably true to a certain degree, but I think the reason we elected this system and probably Ketchy can answer better, is because it is equal for all the contestants. It has been tested in multiple of these Jeopardy sessions, and it seemed like the most reliable option in this COVID pandemic world. So again, everybody has the same disadvantages and advantages. And right when the Jeopardy invitation is sent to the teams are notified to kind of be aware of these issues and see what is the most reliable way to do it. So
I agree. All right, so everybody is in, and we will reveal the answer. So the correct answer is, what is methemoglobinemia? The second part, what is the causative agent? Is it as a topical anesthetic? And so any answer like benzocaine, lidocaine, cetacane would have been acceptable answers here. And the treatment for this, which people got, was methylene blue, or even ascorbic acid has been described. So the people who got it correct, we have team 2 got it correct, team 4 got it correct, team 7 got it correct, team 9 got it correct, team 10 got it correct, and team 11 got it incorrect.
Okay, so the only one that got it incorrect so far was team 11.
That's
Dr.
correct.
Goldberg?
Everyone else got it correct. Team 11, I believe you wrote propofol was the causative agent, but it was actually the topical anesthetic instead.
Okay, wow, great job. So
Excellent job, guys and girls.
Guys is collective, I think. We're with
That's
that.
all. You know.
Like it. So what I have, you want me to read them out to you, Dr. Goldberg, for final?
Yes, please.
All right, team 2, we got 3,000 plus 500 is 3,500. We got team 4, 900 plus $50 is 950. Team 7 wagered everything, so they got a total of 600. Team 9 only did $1, so they're up to $1,001. And team 10 wagered everything, so they're up to 800. And team 11 still was knocking out of the ballpark. So 4,900 minus 1,150 is $3,750. Wow.
Very good. Team 11 is the winner. Good job.
Woo!
Team 2 came in second place, very close behind, and all the rest of the teams, you guys did a great job. Thank you for joining us today. This was really great. Thank you so much.
Yeah, awesome. And Letitia, can you just let us know
so much.
which of the teams goes forward for the state, for their states, please?
You bet. I have this on 2 separate sides of paper. So, okay, team 2 is Minnesota. Team 4 is Vanderbilt. So Minnesota, Vandy. Team 7 is UTGSM. Team 9 is Stanford. I should know these. I'm sorry, guys. And team 10 is UCLA. So you're both in California. And UMass is in Mississippi. So I'm seeing Ketchy, Stanford and UCLA. Stanford has more points. So does that mean they're going forward?
Yes, so that means Stanford University goes to ACC 21. Thank you. And what about for Tennessee? Who goes forward, please?
UTGSM is 600 and Vanderbilt in Tennessee. Oh my gosh, 950. So Vanderbilt has more points.
So Vanderbilt gets to go to ACC 21. Congratulations. And for Minnesota, who goes forward? Is it Mayo Clinic?
Minnesota is team 2, Mayo. Yep.
Okay. Congratulations, Mayo. Nebraska is automatically qualifying, correct?
Yes.
Congratulations, Nebraska, for playing. And Mississippi, well, they go forward.
You
okay.
bet.
Well, let's commend everyone. We're just really, you guys were just great. The way you handled everything, the teams, you are very professional. That's what we can say. You guys were just awesome. Your professionalism today just shone through. Your sportsmanship was just amazing. So well done. This is great. Just watch this, the way you guys all played. So thank you.
It was awesome. Congratulations to not just all the winners, but all the players. I mean, again, like Ketchy said, the professionalism you guys displayed and the patience with working with all the technical glitches, it's commendable. The questions were very tough, but you guys did amazing. You guys did really amazing. So congratulations, a huge congratulations to all the teams and to the winners.
Really well done, everybody. Thank you for playing.
Excellent job, guys.
Thank you to all the organizers.
Thank you, guys.
It's a pleasure. Thank you for joining us.
Good luck coming up, guys.
Thank you from the Mayo team.
Stay warm up there, guys.
Yeah, quick question for the format on the national on May 15th to 17th. To be the same exact format, everything?
Yeah, so well, we're talking, I just got off the phone with Kristen West a few minutes ago. We're just talking about this. We believe we're still going to go ahead with the buzzer. So this same buzzer is what we're going to go ahead with. We just discussed a couple of technical issues. Maybe we'll have, that will not affect you. Probably the moderator will not have to run the PowerPoint itself. But the thought is we're going to go ahead for the nationals with the same buzzer system. Unless something else changes, it will be the same buzzer. But we're going to try and work out some fine details about how to make sure that it's more streamlined. So stay tuned. That's the thought. Okay.
One last thing is 11 teams are very crowded for the buzzer also. So would you think that would be less teams like in the last year or like the year before last? It was only 3 teams competing or 2 teams competing, which would be more fair for the buzzer system.
Absolutely. And that's one thing we've had with the buzzer. We know that when there are more people playing, the chances of you buzzing in is frustrating because you're competing against 11 other people. For nationals, we're going to restrict it to probably 10 people only, 10 teams maximum. Yes, for what we had for the states, we had 100 teams to get through. So we had to put it more.
Thank you.
Otherwise playing Jeopardy all month. But for the nationals, I think we have a total of about 40 or at most 48 states. So we're planning to make the team smaller, so at least that way everybody gets a chance to buzz and be called upon.
Excellent, thank you. Thanks again.
Thank you for the feedback.
Dr. Gober, you are amazing. Mahi, you're amazing. Well done. Yeah, great.
Sorry about all the technical difficulties.
No, the way you
unfortunate.
guys were on the fly coming up.
I think the questions were pretty tight over there. And the teams did great answering those, but those were some tough questions, I would say, Alan. But that was very nicely done, even with all the technical glitches. I think you really kept your cool and your composure.
Solution. I was like amazed.
Wow,
I just sent this to you. Look at my paper. That is like a nightmare. Never let them see you sweat.
No, you did an excellent job. Thanks for your help. It was I don't know what the deal with the PowerPoint is though. I mean, it's all on a PC. It was just getting stuck at first, and then